Hi everyone, I'm Dr. Ankita Gharge. I'm an obstetrician and a gynecologist. So today we are going to speak about period discoloration. Talk about what actually period discoloration is. So it might actually, tell you how it sounds. So there are different changes in colors which can happen during your periods. So periods can change, it starts with something like spotting, which can be brownish, blackish in color, and it can change to bright red and then pinkish in color. Okay. So these all discoloration can happen very normally in your regular periods as well. So that happens because of the flow of the blood and definitely the acid which is present inside the vagina, which changes, the color of the blood because of the acidification of the blood. So these are certain changes which are very normal and can happen during your period, and we are going to discuss more about it. Many people encounter brown bleeding during their periods, and it is because of change of the color of the blood when it passes through the vagina. So your uterus, it actually sheds out the blood, and it comes through the mouth of the uterus, which is the cervix, and it comes to your vagina. So vagina has acidic fluid. So when your blood, which is red in color, it comes in contact with the acids which are present in the vagina, it changes its color from red to brownish because of the acid, and which is why it can come out as brown blood. It is initially like that in the color, and later, because the blood becomes so much in quantity that the acid is not enough to change the color or do the acidification procedure, it changes to what the normal color looks like. Some people can experience the brownish spotting for a very long period of time. That might be because of hormonal imbalance. Okay. Or if you are having some brown color discharge even without having periods, like in between your periods as well, it might be because of certain infection which is present around the cervix, which is the mouth of the uterus. This is an indication that you should definitely speak to your doctor, because you might need an examination, either physical or hormonal. You are observing brownish discharge, which is happening for a very long period of time. By that, I mean more than 4 days, 5 days, or a continuous 10 days, 15 days. Or if it is happening in between your periods, like your periods were on 1st of January, and if you experience spotting for 2-3 days, maybe 15, 16, like that, then this is, and it has happened for maybe 2 days, 3 days, or if it is happening after an intercourse, right? So that is an indication that it could be because of something present on the cervix, which is the mouth of the uterus. That could be an infection, that could be a cancer growth, or that could be a polyp, okay, which is there and which is just shedding out blood. So it could be certain benign condition or certain malignant condition. But if you're observing it and if it is definitely severe in quantity, then I would advise that you see a doctor, get yourself checked, and rule out all these causes. For period discoloration, I can add that what precautions you should take, like you should go for a pap smear, HPV vaccination also. What exactly you should do to prevent yourself from certain, cancers which you get to see on a day-to-day basis. I will speak about certain prevention techniques which you can do to prevent yourself from cervical cancer. Okay. So there is a screening procedure called as pap smears, which has to be done every 3 yearly. So this is a procedure in which we take out the fluid which is present at the cervix, which is the mouth of the uterus, and it is examined under a microscope. And, it has to be checked whether there is a chance of, turning it into a pre-cancerous lesion or a cancerous lesion. Okay. So if it is indicative of anything which is abnormal, then it can pick up a cancer 7 to 8 years earlier. Because we are speaking about menstrual hygiene, I think we should definitely talk about certain screening procedures which should be done to take care of, our health, genital health, and also the cancers which are very, very common nowadays. So I would request everyone to go ahead for a pap smear screening. So pap smear is a procedure in which we take out the fluid from the cervix, which is the mouth of the uterus, and it is observed under a microscope for any changes which are, very similar to a cancer or a precancerous lesion, which actually, present to us 7 to 8 years earlier than the actual cancer. So we can pick it up very quickly, and we can definitely save you from having the cancer for sure. Okay, so you have to go ahead with pap smear every 3 yearly. There is also a vaccine which has been developed against, the cancer. So HPV, which is human papilloma virus, is a causative factor for this cervical cancer in 99% of the cases. So make sure that you actually, revise or remind yourself whether you have taken this vaccination or not. This vaccine is available in two forms, which is Gardasil 4 and Gardasil 9 right now. So the 4 and 9 number indicates against how many strains it gives you protection against. So you can decide for yourself, doctor, and decide the best vaccination for yourself and go ahead and take.